Good morning, my name is Kirti Madhu and I'm the founder of EMBr. 81,083. This is the number of people that experience a fatal overdose every year. This number makes up about 72%. 72% of this number represents opioid-related overdose deaths. And this skyrocketing number costs our U.S. healthcare system $550 billion every year. I recently met a couple, Ellis and Patty, who lost their son to an opioid overdose. He was in his room all alone, and Ellis and Patty had no idea what was going on or what was happening to him. Now, what could have been different if Ellis and Patty had a way to know exactly what was happening to their son and could get him quick treatment? That's where we come in. Like I said, my name is Kirti Madhu. I'm a senior at St. Louis University, majoring in medical sciences and women and gender studies, and I currently work at Prevent Ed, a local prevention organization here in St. Louis, as an educational support intern. Through the creation of this business, I've had a couple advisors, Dr. Jennifer Bello-Cottonsteady, she's an addiction medicine physician, as well as Dr. Jeffrey Scherer, who's an epidemiologist who specializes in substance use disorder research. So originally, this idea started out as a naloxone patch, a patch that would detect an overdose and immediately inject naloxone directly into the bloodstream. After doing a lot of customer discovery, it was very clear that this is not what our customers wanted. They didn't want something invasive or something that would put a drug into their body without their knowledge. Which is why we decided to pivot to a detection device. And that's where the EMBr bracelet and the EMBr app were created. So let's start with the EMBr app. So this app is something that might fit someone better who has access to smartwatch technology. So they'd easily be able to download the app onto their phone, connect existing smartwatch devices, so anything like an Apple Watch, a Fitbit. Through this app, they would be able to monitor their vitals, add emergency contacts who can also see this information. In the case of an overdose, their GPS location and their vitals would be sent to EMS services, as well as those emergency contacts so they can know where they are and what's happening to them. Now picture someone who might not have access to this technology. They would benefit from using our EMBr bracelet. So this is something that would be distributed through local government organizations, prevention organizations, and just community organizations. So through this bracelet, users would be able to wear it. It would track their vitals, so in the case of an overdose, not only would EMS get their location as well as their vitals that bracelet is recording, but there's an alarm on it, so if any bystanders around, they'd be aware of what was happening as well. So this is kind of our business model, how we'll be getting our revenues. So for the app, we're planning on doing a $4 monthly subscription and looking into possibly doing an annual subscription as well, so people wouldn't have to worry about that monthly subscription. And this would be marketed mainly through health professionals, so a provider could recommend that their patients download this app if they have that technology, as well as social media ads as well. And the bracelet, like I said, this is something that would be provided through government organizations, so funds like the Opioid Settlement Fund. So just in Missouri, the Opioid Settlement Fund is about $16 million. Other states have more money, but usually this money isn't used up, and only a little fraction of it is used. So this money could be targeted towards developing that bracelet, getting it into the hands of local community organizations to then distribute for free to everyone to make it more accessible. So looking at our competitive advantages, our biggest competitor is Brave Co-op. So they're a motion sensor system that's placed in public areas like bathrooms to detect motionlessness and then alert that as an overdose to get them help. So while Brave Co-op eliminates stigma, has an established network, and can offer peace of mind to users, EMBr does these things as well. We already have an established network pre-launch. We work to eliminate stigma, and we offer that peace of mind not only for users, but as well as their family members and their support network. We also provide automated alerts. So just by detecting your vitals, we're able to provide that alert to you, EMS, and your family members, depending on what, if you have the app or the bracelet. We provide comprehensive health monitoring, so it's not just looking at one vital, it's looking at multiple sets of vitals to be able to ensure that accuracy of detecting an overdose. And then we also provide a proactive intervention. So with existing treatments like Narcan, we're able to bridge the gap between prevention and treatment and provide that proactive intervention. So with our detection instant alerts, we're able to provide a rapid response, and then EMS who have Narcan in their hands, or even bystanders who are carrying Narcan, are able to provide quick treatment to those who are suffering from an overdose, to provide quick reversal, eliminating opioid-related deaths. So this is kind of our timeline, what we've already done. So I'm in very early stages of developing our company, so we just started in June. Again, did a lot of customer discovery, creating initial prototypes, expanding our network of potential customers as well. Recently, we just started the process of filing for a patent on our device, and we're actively looking to add team members to the company. And then in the future, within the next month or two, we're going to be looking to secure additional funding. So if you're interested, I'd love to get your name and email at the end of today. And then throughout the rest of the year, we want to get final adjustments finished on our products to then be ready to launch at least our app by the end of this year. Thank you, and